And I'd like to welcome everyone to Coffee with Dr. CJ. I'm Cathy J. Campbell. I'm a family physician and sport medicine physician at Cleveland Clinic, Canada, in beautiful downtown Toronto. I have two wonderful guests with me today that I'm going to introduce shortly. This webinar series, this is number 10, started a couple of months ago at the beginning of COVID-19. And we talked about a number of things that have come up during this time. Issues like parenting, trying to parent while teaching our kids, being the teacher, the school teacher, being the cook, the chef, the exerciser, and also trying to work from home. We talked about exercising during this time with our gyms closed and so forth. We've talked about eating and diet. We've talked about trying to cook bread without flour and yeast. We've talked about stress and anxiety at this time as we have loved ones that we can't see or we're worried about. We've talked about the anxiety of going back to work. And about our own mental stress and mental health. I also today wanted to thank Cleveland Clinic Canada, especially our executive team, Cleveland Clinic in Ohio, and our wonderful CEO, Mike Kessel. They've kept us all working at our Midtown and our downtown clinics in Toronto, Ontario. So we're very grateful and thank you all. Today, I'm delighted to welcome two guests who are fabulous. And I told them at the beginning that the best part of this job is that I get to meet people like them. I've met them before, but we're at two different clinics in Toronto, so I don't get to ask them all these nosy questions and find out more about their lives. So I'm delighted to have them. They really are rock stars. They've done amazing things. So I'm going to first start with Marla. And Marla Pichler is a physiotherapist extraordinaire. She's at our Midtown clinic at Cleveland Clinic in Toronto. And she does everything. She's a manual therapist, but she does every type of physio possible. She's worked at two Winter Olympics and in '84 and '88. She looks way too young to have worked at two Olympics in '84 and '88. And what I pulled out of her, because she hides her light under a bushel, is that she is the first woman to accompany a male team, and she accompanied the bobsled team, I believe it was, and she can correct me if I'm wrong, but she's worked at two Winter Olympics. She's the medical coordinator for the Canadian Tour of Stars on Ice for your figure skating fans. She makes this happen. She is also the medical coordinator for Battle of the Blades, which is that TV show where they hook up a figure skater with a hockey player, and it's a great, great TV show. She's also the director of dancer health and wellness at the National Ballet of Canada. Of course, I'm a huge fan of ballet, so I have a million questions. I go to all the ballets, and I'm a patron of the arts, so I love the ballet, so I have many questions for her. And she's an expert in so many areas, in mechanics and movement and preventive medicine and so forth. So we'll see more of that today. So thank you for being here, Marla. And I'm going to quickly introduce, not so quickly, Michael Clarfield. And Dr. Michael Clarfield.
Cathy, you're on mute.
I'd like to introduce Michael Clarfield. He's the sports medicine guru in Toronto. He's had an amazing career thus far, and it continues. He trained at mainly in Toronto and at Western. He is he ran his own sports medicine clinic for 26 years in the Midtown clinic until he joined Cleveland Clinic. He's the current medical physician for the Toronto Argonauts. My brother-in-law used to play for the Toronto Argonauts, so it's great team. He is the physician for Tennis Canada. He is the company physician for the National Ballet as well, and was head physician for the Toronto Maple Leafs for many years. Now he does all the on-ice NHL officials' medical care. So welcome to both of you. And before we start with the multitude of questions I have for you, I just wanted to see, how are you both through this time? And how are your families? How is life? How are you coping? Maybe starting with Marla, how is life?
Well, life is actually not bad, Cathy, and thanks for having me on this webinar. We've been working virtually from home using the Zoom platform, and I've been seeing patients, Cleveland Clinic patients, and I think it actually works fairly well. It surprised me, it surprised all of us actually, and we were able to make really great active exercise programs that have been helping our patients through the rehab process. Of course, there are some of them that are desperately missing our hands-on treatment, but by and large, I think the patients are doing quite well. It's been a stressful time. It's stressful for everybody, and keeping in check with the dancers is something that we do on a very regular basis. We're very concerned about their mental health, and we're very concerned about them maintaining some sort of physical training so that when we are allowed to go back, that they're not too far off the mark.
And speaking, I'm going to carry on with Marla before we talk more with Michael and see how you're doing. Since you're talking about ballet right off the bat, and because I'm such a fan of ballet, I thought we could talk about some of the considerations in return to sport and return to dance in particular. And Marla, as I've mentioned, you work with the National Ballet. You're intricately involved with their wellness and health and so forth. I know Karen Kane is retiring this year, who was the director. And so it is a crazy time of change anyway. And with COVID, you know, if we reflect on this picture, it's a beautiful, we call it a pas de deux. And a pas de deux means dance for two people. So this pas de deux, dance for two people, has Guillaume Cote and Heather Ogden, who are two of your principal dancers at the ballet. They happen to be a married couple. So a pas de deux during COVID is not a difficult thing for them. But maybe speak to the difficulties that you are having, and where is the ballet in terms of coming back to dance again together?
Okay, so let's talk. First of all, COVID has brought the ballet one really good positive thing, I think. It's given our dancers a chance to get off that treadmill that they are constantly on in their everyday life. Mm-hmm. They are very hardworking athletes. They start first thing in the morning and they don't finish until 6:30 at night. They have a short 1 hour break over lunchtime. And one of the challenges that we constantly face is getting them to cross-train. So the fact that they're not in the studios and not rehearsing now has given them a chance to cross-train. So that means getting on other pieces of equipment except for their toes. And so that's been a really good thing. They're weight training, they're doing lots of Pilates, they're doing lots of yoga, they're walking, they're cycling, and so they're trying to keep themselves fit. And in doing so, they're able to do it in a multitude of ways. So that's been a very strong positive thing. Yes, Cathy?
Now the other thing is that I guess, you know, they chronically have so many injuries, is my experience. And so it must be also a time to allow a little recovery as well of sort of the chronic whatever, tendonitis or whatever issues. So that's probably a positive as well as the cross training, as you mentioned. Carry on.
It is, and we have available to the dancers our full team, and so they can get treated over a virtual platform as well. We're sending them programs. Self-treatment is being taught over the computer. And yes, I think that the just time away from what they repeatedly do every single day of their life is a great thing. Now, of course, it brings lots of challenges to us. And as you said in the beginning, that Heather and Guillaume are lucky. They can practice lifts in their living room. But it's really difficult for the rest of the company who either live separate or live with people who are not dancers to practice the actual sport specific things that they need to return to dance. We've done lots of things. I think I was talking to you before that we cut pieces of flooring that we use at the theater, and each dancer was given some special flooring so they can continue to do bar and jumps in the center and small movements in this area of flooring that they were given. But of course, there's nothing like having a studio to yourself or studio with a partner to get yourself back into dancing shape.
Mm-hmm. Well, I'm trying to picture doing a lift in my house, and luckily the ceilings are fairly high, but I think that I heard they're in a condo, so it might be a little tough to even do lifts. They may be doing them out on the patio or something, huh?
Well, you've seen some beautiful shots of our dancers, you know, in isolation at a park, just doing unbelievable dance moves. They've been really prolific on social media, and some of the stuff that they're doing is just absolutely incredible.
Yeah, great. Those are, the more stories the better. I love the practical stories here. And Michael, so your turn, Michael. This looks remarkably like you. And if I'm not mistaken, it is a picture of you from Spain. Michael's an awesome cyclist and athlete. And first, Michael, tell us how you're doing through this COVID-19. And then I have some more questions for you.
Well, first of all, Cathy, it's great to be on your Coffee with CJ. It's such an honor to be on the show with you, which is great. Thank you so much for having us on. We're all doing great. The family is doing great, except for my poor wife who fractured her ankle a month ago, who's been hobbling around. But other than that, we're all doing great. As Marla said, the pivot to virtual care has been very interesting, and for the most part, mostly very gratifying. But on the flip side, there's been frustration that we can't do physical examinations, we can't do the imaging, and some of the definitive treatments like injections we haven't been able to do. So although we're doing well with the virtual care and we can help a lot of our patients get active, there are some that are not been receiving treatment that they do need, which will be nice to, in a few weeks' time, when we are back open, to get back doing those things to get our patients better and to be more active and more comfortable with the issues that they have. So it's a bit of a bit back and forth that have been mostly very gratifying, but some ways a bit frustrating. In these
and this picture's from Spain, right?
It is. Yes.
Well, elaborate here.
Yeah, the same. We're supposed to go back to Spain in May with the same group of gentlemen, but obviously we had to postpone that trip.
Yeah. So one thing we spoke about last week was we were talking about I was commenting that we were probably going to see this flurry of overuse injuries, which is the most common sports medicine injury that we see is overuse. Probably both of you see a lot of overuse injuries just as things start to open up and people start exercising more. And it was interesting because you're seeing a lot of overuse now. And maybe you could speak to that and how COVID has affected the types of injuries that you're seeing now.
I think there's two sides to this coin, Cathy. For one, a lot of my patients I've been seeing, because they are working virtually from home or from their summer homes, whatever they're doing, and I can say from personal experience as well, they actually have the ability and the access to exercise a lot more. Take away that commuting time, going to their office downtown, and their access to their home gyms or running or biking outdoors. I have a lot of patients that actually, and myself in personal experience, have probably done way more exercise in the spring than I've ever done. And so that has brought up a whole series of overuse injuries, which I've been seeing on a regular basis every day. So that's the one point of view. And there's a positive to that as well, obviously, that people are doing way more exercise. On the flip side, people are home. And as we talked about earlier too, about this COVID-15 of this, people are gaining, 10,
Quarantine
15
15, yeah.
Yeah, because there's so much easy access to the refrigerator and cupboards at their home all day and not in the office, that people are putting weight on. And some people don't have access to gyms and places where they normally go exercise. And when they re-enter into, phase 2 and phase 3 of the COVID recovery, when they go back to their gyms and take the added weight they put on, as well as their inactivity, I think those people may be more prone to injuries as well. So we're seeing two sides of that equation. And as Marla said already too, for their higher level athletes, we have a lot of your athletes who are working at high performance levels or training for events, triathlons, marathons, whatever they're doing. They can train what they can do at home, but we're missing the specificity of the actual activities they do. And there's no way you can mimic the actual specificity of things like ballet dancing or hockey or basketball by doing your training at home.
Mm-hmm. There's an interesting story about Michael Jordan, and I guess there's a whole lot of material about this. When he stopped playing basketball at one point and started on a career in baseball, I think it was.
Yes.
And this story was shared with a gentleman from RBC Bank, Andre Roberts, who was telling me this story that he took 6 months or more off and decided this pro baseball career, and then ended up at some point going back to basketball, and how difficult that was for him. He said he took on a whole other, everything worked differently. And we see that a lot. Look at swimmers. I mean, I interviewed an Olympic swimmer several weeks ago, and she's not in the pool, she's not swimming, she's doing biking on her veranda or something. And the worry with swimmers is, again, about specificity. Being an old phys eder, specificity is really so important. And specificity means being specific about your training, that it mimics the competitive sport or activity that you want to do. So in swimming, we know that weight-bearing exercise increases bone density. Increased bone density increases weight. So swimmers actually, if you're not doing a lot in the pool, it can actually change your angle or level in the pool, which will affect your time. So, so specificity is certainly a big issue, as you've said. Another thing in return to sport, has to do with considering all the different COVID issues. It's hard enough to get everyone back in shape and fit again if they haven't been working out, but now we need to consider all these safety recommendations as well. And in particular, things like, the 6 foot distancing, face masks, hand washing, disinfecting, cleaning, and taking temperatures. How do you think about that with the ballet, for instance, Marla? And Michael with football? Tennis probably okay, football a little tricky. So maybe start with Marla, and although there's no right answer, I know you're thinking about all these things, and so how do you think about them?
So to speak about where the ballet is in our return, we're at the stage now where we're waiting for the authorities to let us come back to the studios, and we're starting to formulate a plan. We have 4 studios in our Walter Carson Center, 4 separate studios, one of which is very large, and then the other 3 are a little bit smaller. And what we're planning to do is have 4 dancers in each studio. In the largest studio, we will have a pianist, and we will have a ballet teacher at the front of the class, and that class will be then transmitted into each of the other studios as well as recorded, and the dancers who are not going to be in the Walter Carson on that given day can take the same ballet class from their home. So that way we're keeping the social distancing from it. Then as far as the face masks go, what's interesting is our wardrobe department started making face masks way back when, and each member of the company will be given a certain amount of face masks, and they will have to wear the face masks when they are in the Walter Carson Center. I'm not sure at this point if we're going to make them do ballet class with a face mask on, or if they can take that off. I mean, I believe as a practitioner, it's going to be very difficult, obviously, for them to do a ballet class with the mask on. So they'll be screened before they come to the Carson Center. I believe that we got to the point where they'll have to fill out a questionnaire. They'll then have to fill out the same questionnaire when they arrive to do ballet class. They will have their temperatures taken by a laser thermometer. And we are trying to keep everybody on the same floor so that we're not infecting too many floors. One of our biggest issues is if and when we go back, if somebody comes down with COVID, all the people who associated with that particular person at that particular day would have to then be quarantined for 2 weeks, and that would set us back again.
Contact tracing is huge, for sure,
Yeah.
and very important. And I know our team at Cleveland Clinic, I've been involved with the team on return to work for different corporations. So we have great checklists, and I'll make sure I send them your way.
That'd be great.
Would be a help as well. And we also have an initial questionnaire that we've devised that people, it's a self-questionnaire as well. So good. Right. So you're thinking of, you're obviously thinking of all the safety issues and trying to do it as carefully as possible. Michael, what about with your sports? I mean, how do you do?
You know, it's very interesting. Just divest for 1 second. We talked a bit about return to sport and specificity. And it's interesting now with the NBA, NHL, and meetings regularly with the NHL now about how we're going to return to play. And for the players themselves and for the officials, it's very interesting. We are doing this cross training at home, but they're going to go back into an environment where they've been off the ice for quite a number of months and going back into a playoff scenario right off the hop. And as we know, first of all, they're going back, and from even when they start back after summer going to regular season, they're more prone to injuries. And be the same thing this time, but the difference is that they'll have less time for a training camp and going back to a playoff scenario, which in essence is a war every single game, and probably 10 times the intensity of a regular season game. So it's going to be very interesting to see how the players at that very elite level will respond to that, and how many injuries we do see from their lack of game time experience and going right into a much higher intense level of competition. But going back to what you're talking about other sports and what we're looking at, and the more you analyze things and look at these things and think, oh, it's pretty easy, we'll do this, we'll do that. And then the more you get into these deeper scenarios of returning to sports for the professional recreational athletes, as you start chunking it down, you every scenario creates more issues and problems that you didn't think about yesterday. They have to plan for tomorrow. As Marla says, one dancer goes down, how do you manage that? Or people around them, or they're living with someone who has COVID, and and how different the country is. The incidence of COVID is increasing. You look at Arizona, who was doing very well, and then opened the state up, and now they're, great numbers of increased numbers of COVID there, and other states don't have that, and so it's variable, and there's so many things we don't know. What we do know, though, is a bit that probably outside transmission is a lot less than inside transmission, and most of the higher incidence of COVID contact and people getting COVID virus have been from prolonged inside contact.
Yeah. And
so the outside contact probably is still there, but of a much less incidence. So I think from the a priori, we should encourage people to consider doing outside activities as they're going back. Things like golf, which is by naturally is self-isolating. For the most part, you're just social distance away. You're not touching on people's balls or equipment, and that can be quite safe. And we want to encourage people to go back to doing their activities for their physical and mental well-being. Tennis, you mentioned. There is some touching of balls, but there's ways to mitigate that by using your own balls when you're serving and not touch balls with your hands of the opponent's balls. Other sports with close contact, as you say, like basketball or football, there's other factors that come into play that, that you just can't, by the nature of the sport, you can't change dramatically. I mean, do football players go on to wearing full face masks when they're playing, things like that, to mitigate the transmission of the virus through their breathing and droplet transmission. So there's other things we have to think about all the time.
And we've been trying to get those male hockey players in full face masks anyway. So now we can do it.
I was talking to our referees. Can we, maybe have them wear a full face mask with a 2-inch whistle, so they can blow the whistle through the face mask, or use a handheld whistle. Get a noise in their hand, so they're not blowing and dispersing droplets around. I mean, there's all sorts of things we're thinking about, which can potentially, hopefully, mitigate the transmission of this crazy virus.
Very, very interesting. And Michael, we both took part in this recent CASM webinar, and CASM, give a little plug for CASM, is the Canadian Academy of Sport and Exercise Medicine, and it's kind of the national group that all sports med docs belong to, including us. It's their 50th anniversary, and they did give a whole seminar on return to sport, and they developed this assessment tool. On this webinar that we took part in, they reviewed all kinds of information from key principles of return to sport, planning, overviews of return to sport, risk scores, mitigating strategies, medical risks, and even looking at strategies around specifics of para-athletics. So what were some of the takeaways or messages that you took from that webinar series, or that you're already doing, and you've spoken about some of them, in helping your patients or athletes, especially at the elite level?
I think the first takeaway was that the more you think about it, as we talked about before, the more complex it is, more than you initially thought. And that is, a priori. Certain sports, as you say, are easier to manage than other sports, by the nature of the individualized nature of the sport and the outdoor versus indoor. And I think it's important too that, COVID is for some reason seems very different by country, even by province within the country. And so it's important that we have to respect the guidelines set out by the provincial and country or state or wherever it is, guidelines to how we progress. So what may be okay to do in British Columbia now may not be able to do in Toronto because of the nature of the incidence and transmission of COVID at this time. So that is the first thing. We have to respect the guidelines, and we can't go against the guidelines that are given to us by our governing bodies that are controlling what we can and cannot do on returning to life as we previously knew.
Mhm.
And then each individual sport has to have their own guidelines for their training for one now, and then from the training progressing to specific training, and then progressing to training camps and progressing to competition. So it's a very, very slow process, and going through each phase, we have to monitor what's happening each phase and only progress when it is okay to progress to the next level, which is important, that we keep analyzing what's happening within that individual's person and within his individualized state and country of what the nature of COVID is doing. And what we may think is okay now in 3 or 4 weeks' time may change dramatically as the disease gets better or gets worse, or whatever or a vaccine or treatments. There's so many things that we're working on which will change this, but it's there's so many. And if you look at even Cathy, you and I know and Marla, as physicians, I mean, we read everything, we watch so many webinars and read so much literature, and the only thing we do know is that even the experts don't know.
Yeah. Well, that's what I was saying to both of you in the beginning is, don't be alarmed if you don't have like the answer for everything, because clearly no one does. And it's about using the principles we do know and doing our best to apply them to the different situations. And that's useful information to all the audience as well, is that, realize that, these are the basic principles, whether it's the 6 foot, the mask, this, and try to stick with those and incorporate that into your other activities. When we talk about return to sport, and I'm going to move us along here so we can get some more questions, but when we talk to return to sport, we talk about many of these issues. And as you mentioned, the permission from the authorities to even do these, whether it's the government, whether it's whoever it is, we need permission first. And I'm going to keep moving here and wanted to get some of your, some more operational thoughts on return to sport, Mike, and wondered if you can discuss some of the operational principles in terms of what are your plans? Like, I know they say, you're back with football. If they do play football, what's going to happen in terms of spectators and so forth. And maybe you could add some comments to that.
I think from the athletes and from the spectator point of view, what I fear is that, we're so tired of being isolated, and that people are being a bit maybe too cavalier when we are thinking about going back to life. And it is not a switch, an on and off switch. And I think some of the states in the US, you can see that they think it's either you're isolated or you're back to full activity and full life. And you see the risk of that in Texas and Arizona and Michigan and California, where the incidence of COVID is now increasing as people are getting less cavalier. I mean, you look at people, this protest going on now without any mask, I mean, close contacts. I think people don't realize the severity of this thing. And it is not just either you're isolated or not. It is a slow progression, and we have to, each individual has to maintain what their risk is and what their risk profile is and what they want to get back to doing, but to be very cognizant and very respectful of the principles of the 6 feet, of the wearing masks in public, of the most important thing is washing your hands and sanitizing your hands at any touch points or at contact, and to really be still.
As you were saying before, one of our big problems is going back to the theater. And as you know, a company like the National Ballet makes their money on ticket sales.
Right.
And the problem is that no time soon are we going back to the theater. And, people say to us, well, why don't you just make a video and have people be able to watch that from their homes. And
sort of like the Met does with the opera right now.
Exactly. And that's a great idea, except for us to create a video with the expertise that would make it worthwhile for people to watch at home. The cost is actually, it's huge.
Astronomical.
And so that would be an added expense to the company at a time where the money coming into the company is not what it usually is. Mm-hmm. You know, we're very, very lucky. We have very supportive donors and people who support the company and are continuing to support the company. But without them, we would be in probably huge trouble.
Thanks for that, Marla. And sorry we cut you off there, Michael, but I'm going to keep going here because it looks like we have 5 minutes left. So I wanted to briefly talk about about this issue, and that is that, as we all know, Tokyo 2020 is not going to happen. It was delayed or postponed for a year, and there's some question about whether it will even happen in a year. So that's a worry. What are some of the biggest problems that you've seen in terms of what are the big risks associated with this, like sort of a 1, 2, 3 kind of thing, whether it's ballet and delay of a season or with football? What are some of the issues that the athletes face?
I think, as Marla said already, the financial implications are huge for things like the ballet, which is really, I call it gate-driven, an audience-driven financial model. A lot of sports, professional sports, have TV revenue, so they can do things with no audience and still make significant income. The ballet can't, or the CFL, the Toronto Argonauts, is a gate-driven league, and their income is based on people going to the venue to watch football live. And so, and even in hockey, there are certain teams without that TV revenue, if they don't go back to play this year, there's 4 or 5 teams which could be in serious problems of not surviving this COVID environment. So I think that's from that point of view, the ballet, if you don't get financial support from the government or the donors, could be in serious trouble of surviving. Certain professional teams could be in trouble. And on the flip side, you have individual athletes who are spent the last 4 years training for 2020, and then having that canceled, maybe delayed a year, maybe never happening. Their whole lives have been, committed to doing these activities. And some of these athletes, it's different if you're a dancer, a professional basketball player, a football player. You have a season to go back to. A lot of these athletes, are really have no life until the Olympics. And this is their show every 4 years. And so the psychological implication of that, after training for the last 4 years, I canceled. And do I train for the year? Do I give up my life? Do I go on with life? And can I maintain the drive to get to that level for 1 more year? Is going to be very difficult for these athletes to get through this time. And the unknown is always worse than anything. If they knew for sure it's happening in a year, they could maybe get around that. But even the unknown of, well, it may or may not happen. Do I really want to, can I drive myself to train at this level and go to this level? It's going to be very difficult for these athletes and coaches and teams.
The same is true with the ballet, Mike. We have the same issue where they're just uncertain when we're coming back. We're uncertain when we're coming to the studios to just do ballet class. And as this pandemic keeps progressing, we keep canceling seasons. So, we canceled the June season. We canceled Karen's premiere of Swan Lake, which was huge. We put it on to next year. But are we going to have a Nutcracker season? We don't even know that yet.
Mm-hmm. Well, the mental stress. Sorry,
the
Michael.
dancers who are going to perform in that may say, I don't want to wait. I'm going to retire. And that, the casting and the changes and,
So for all of us dealing with athletes, whether weekend warriors or elite athletes, mental stress, anxiety and mental health are really huge right now for everyone, whether it's return to work or return to play in ballet. So that's all our time today. And I've kind of added some of the questions that have come in as we were discussing. I wanted to thank you both. These two have actually worked together for almost 39, 40 years, which is incredible.
Yeah, since grade 2.
You've had both amazing careers and they're ongoing. So I wanted to thank you for coming in today. And I also wanted to tell you next week, our show is on moving mindfully, and we have some exercise people coming in to discuss that further. So until then, I think we're right at 11:45. So there we are. So thank you very much again. And it's been great getting to know you a little bit better. So have a great day, and thanks to all of you out there. Bye-bye.
Thanks,
Thank
Cathy.
you, CJ.